Good morning.
Good morning. Thank you for joining us. Tell me to begin with, what is the state of the Red Cross blood supply?
Well, in recent severe weather has really impacted the blood supply. Just in the last week, Hurricane Debbie, the wildfires, the tornadoes have forced the cancellation of about 60 drive, which amounts to about 1,500 blood donations that were not collected. And this is now coming on the heels of July, where we saw record heat in a time of year when it's already challenging to collect due to travel and vacation. And so since July 1st, the Red Cross inventory has dropped by 25%, which amounts to about 19,000 units that we have not been able to collect.
What's the most critical need right now? Certain blood types needed more than others?
Well, all blood types are needed on an ongoing basis. No matter what your blood type, we invite you to come out and donate. You will save a life. But type O is in particularly high demand. Both O negative and O positive. O negative is universal and O positive is nearly universal, and both are in tremendous need, particularly for emergencies with high volume transfusion when there's an unknown blood type. But really, for any type of situation, it can be used. It goes to about 80% of the population, and platelets of all types are needed every day. Their shelf life is only 5 days, so we need to be able to collect every day to maintain an adequate supply. And whether that's for a large hospital that manages very complex surgeries, transplants, or a smaller hospital that only maintains a small inventory, every unit that's not on a shelf, on a hospital shelf, can jeopardize timely patient care.
Well, speaking of patient care, since you are a doctor, how is it impacting patients?
Well, the need for blood is constant. Every 2 seconds, someone in the United States needs blood, and blood transfusion really covers nearly every specialty, and it's something that's not well recognized. But blood donation is not only a treatment, but it makes other procedures possible. So the types of patients that might be impacted are cancer patients, mothers who are hemorrhaging in childbirth, premature infants, accident victims, individuals with sickle cell disease, and many more. And so when there's a blood shortage, it starts to threaten timely patient care. There are some procedures that might be delayed, which is not without consequence. But there are, more importantly, even things that cannot be delayed. And so, an emergency does not stop during disaster. Individuals needing hospital care, that doesn't stop just because there are other things going on in the world. So, for example, a trauma victim may require dozens of blood products, and studies have demonstrated that every minute of delay of blood products in these situations have increased the risk of death by 5%. And I was just recently speaking with a blood donor, a young woman who was otherwise very healthy, routine pregnancy, experienced a massive hemorrhage during labor and delivery. And this really exemplifies how unexpected a blood transfusion can be. And so individuals who have been affected by this or some other unexpected event or diagnosis really understand the need and become very motivated themselves to donate. And so I would encourage people to remember there are millions of people who are alive today because a stranger donated and saved their life.
Where can people go to donate?
We would encourage people to visit our website, redcrossblood.org, call us at 1-800-RED-CROSS, or visit our our app, a Red Cross Blood Donor app, to make an appointment. It's very easy. As a thank you, we are offering a $20 Amazon gift card by email for anyone who comes to donate in August. And I would really just ask people, please, as you go about your summer, please remember that there are people in the hospital who need transfusions today, tomorrow, next week. Please come out and donate.
Thank you so much. I appreciate all the information. Have a great day.
Thank you. You too.